Hello, everyone. My name is Samya Palam. I'm currently a fourth year GI fellow. I did this capstone project last year during my chief residency year, and I collaborated on this project with Dr. Fasseas, who's the associate professor in Department of Cardiovascular Medicine. Our project is titled Impact of Modified Interactive Noon Report PowerPoint Presentations on Learning, and our mentor was Dr. Raff. So morning and noon reports are recognized as an essential teaching modality in medical residencies. At MCW, our noon reports are one of the main educational conferences for the internal medicine residents held 4 days a week. The format of the conference entails a resident presenting a case that they encountered during one of their rotations, followed by a presentation on an educational topic pertaining to the case. And both the case and the topic are presented using the PowerPoint as a main teaching tool. The case presentation is typically interactive and it's facilitated by the chief resident, and usually there's a lot of audience participation. However, the educational topic presentation that the resident presents after is typically passive, and the residents just talking the whole time without much participation. There is significant variation between how residencies run their morning and noon reports. In this pilot study, we aim to compare the differences in mental effort and learning outcomes with either an interactive resident-led topic discussion versus a passive resident topic presentation. So we conducted our pilot study from the period of November 2019 to March 2020. We randomly picked noon reports to be modified into an interactive PowerPoint presentation. The resident who was presenting the PowerPoint was provided with guidance on how to make their presentation interactive and also how to improve the format to decrease cognitive load for the residents. After each of the modified and traditional noon reports, an anonymous survey was handed out to the residents with the goal of assessing mental effort and learner retention of information. We aim to obtain data from 10 of the modified noon reports and 10 traditional noon reports. However, due to the COVID-19 pandemic, in-person noon reports were canceled, and we were only able to obtain survey data for 6 of the modified noon reports and 1 of the traditional noon reports. And in order to offset this limitation, we surveyed residents at the end of the 2019-2020 academic year regarding their overall satisfaction and preference for the modified versus traditional noon report. So here's an example of an illness script format that we use during most of the interactive PowerPoint teaching sessions in order to decrease cognitive load. So basically, any disease topic is divided into pathophysiology, epidemiology, time course, salient symptoms and signs, and diagnostic. And the focus was on just high yield teaching points and taking out any other extraneous information that's not necessary for a clinician to know. In one of our first surveys that we handed out after each of the noon reports, we included the PASS subjective rating scale, which is a highly validated instrument for measurement of mental effort that's exerted by the learner during an instructional method. So here's a complete survey, the PASS scale that I just mentioned, and we asked the residents if they exerted a mental effort that was rather high, that is 6 or higher. We wanted them to rate how much that mental effort helped with retention of concepts. And then we also asked them to jot down some key take-home points. And our second survey that we sent out at the end of the academic, here's just an example. It was very simple, 4 key questions, asking the resident to rate which one was more effective, why they thought it was more effective, and which one they were more satisfied with. Okay, so the results. So these are results from survey number 1. Again, we only had data from 1 of the noon reports in the traditional format, but then we had more so with the modified noon reports, so 6 of them. So kind of have to take these numbers with a grain of salt. But basically the mental effort was a little bit higher with the traditional noon report. However, the residents did rate that it very much helped with the retention of information. However, only 30 or so percent of the residents were actually really able to jot down the key take-home points. With the modified noon report, the mental effort was a little bit less than the traditional noon report, and the average was somewhere between very much able to retain information versus somewhat able to retain information. And then more of the residents were able to jot down the key take-home points accurately. So with our second survey, where we asked the residents to rate which one was more effective for their learning, majority of them chose the interactive PowerPoint teaching method. We asked them to comment if they chose one or the other. In terms of residents who chose the interactive PowerPoint teaching method, majority of them said it was more engaging, that active thinking is better for their learning. So I think those were the common themes in these comments. And then these were the comments from residents who chose the traditional PowerPoint teaching method as more effective. And these were people who typically felt that they learned material better in like a lecture format or the classic teaching format. And then majority of the residents thought that the interactive PowerPoint teaching method was more effective for retention of information. And more residents were satisfied with the interactive PowerPoint teaching method compared to the traditional PowerPoint teaching method. Okay, in conclusion, less mental effort was required during interactive PowerPoints teaching sessions using the illness script format. We were unable to ascertain if there was improved learner retention with traditional versus interactive PowerPoint teaching due to small sample size of the traditional noon report. And interactive PowerPoint teaching is a feasible method, and there was high resident satisfaction with the interactive teaching method. And here are our 3 C's and our character artifacts. Thank you for listening.